Let's talk about an important part of the Duet therapy, electrode placement. The pattern of electrode placement should be in diagonal or crossing orientation. In other words, place the electrodes in an imaginary X or plus sign configuration so two electrodes of the same color are diagonal from one another, as you see on your screen. What you see demonstrated here is the correct placement for a wrist therapy. As you can see, the electrodes form an imaginary X on the treatment area. Once the electrodes are in the proper configuration, press the edges of each pad firmly to ensure a secure connection. Now we will demonstrate the proper electrode placement for a knee therapy session for the treatment of pain and swelling in the knee joint. Again, the treatment site should be clean and dry before attaching the electrodes. First, place the red wire electrodes in a position that represents 1/2 of an X. Once the red wire electrodes are in place, attach the white wire electrodes in position to complete the X as you see here. This is the correct way to place the electrodes for knee therapy. For knee pain, you can also place the electrodes further up the thigh since pain impulses travel up the thigh from the knee to the brain. Begin by placing the red wire electrodes further up the thigh, one on top of the thigh and the other on the back side of the thigh. Place the white wired electrodes on the inside and outside of the thigh. This orientation is best suited for pain in the knee and will have little effect on swelling in the joint. Refer to the printed electrode placement guide and the electrode placement examples on this video for more electrode placement guidance. The prior examples are intended to guide you in electrode placement for all therapy sessions, illustrating the proper X orientation of the electrodes. Remember, consulting your physician and/or your physical therapist prior to using the Duet pain reliever will help you to determine the most effective electrode placement for your specific condition.